Here's how to get fast inner knee pain relief for people suffering with arthritis. If you have knee arthritis, sometimes the pain will be focused on the inner part of the knee right here, or on this right here if it's on your left knee. If you have a history of having a meniscus tear or an ACL tear, there's a chance that your knee joint might be a little unstable. If you had a meniscus tear, that's the cartilage inside your knee, one of the pieces of cartilage, that can also produce some instability within your knee. Anything that leads to an unstable knee at some point in your life might predispose you to continue to have some instability in your later years that could be setting up some arthritis. That instability can lead to the joint shifting, and we call this a tibial shift. This is the tibia right here, that's the shin bone, and then up here in the thigh we have the femur. The connection between those two bones might be a little loose in some people with knee arthritis, and that can be a major cause for inner knee pain. So I'm going to show you first, I'm going to be drawing on you here, where the bones are, because we're looking at the end of the thigh bone, the femur, and where it meets with the top of the shin bone. So here's the kneecap. Let me just draw that out right there. And on the bottom inner corner, if you just drop off the kneecap, so here's the edges of the kneecap, you'll feel some ridges, and then right there is where the meeting between the femur is and the shin bone. You can there's a little divot in the bones right there. So I'm putting the tip of my finger in the joint space, so I know that right below that is going to be the tibia or the shin bone, and then right above that, kind of this way, is going to be the femur. So what we want to do is move the tibia outwards. The most common way that the tibia shifts, and this shift is it shifts medially, the medial tibial shift. You can get a lateral tibial shift, but in my experience when working with patients that have this problem, the most common by far is a medial tibial shift. I'm going to show you both anyway. I'm going to show you how to correct for both. Right now, on yourself, I'm going to have you do it in just a moment. You're going to use the web space of your hand right here, right below that line. And then you're going to use the other hand, the web space and the palm, on the outer part of your thigh. You can put your hand this way with the thumb over, or you could turn it and put your other fingers over. It doesn't really matter for this technique. Then you're going to put your hand right here, and then you're going to be pushing this way in order to push the shin bone, the tibia, this way. So you're giving some counter force with the top hand on the thigh bone, just like this. And then you're going to be giving it some reps. Get your chest close to your leg, because you'll get more force right here than out here. And then you're going to be giving some oscillation pushes. In other words, you're going to be giving it pressure like this. So I drew the lines for you. So we're going to do the right knee first. So you're going to put this hand, web space, right below that line that I drew you there. Good. And the other hand on your thigh bone. Perfect. Get your chest closer, so you're going to have to lean in. And then give it those oscillations that I was talking about, that pressure. Yep. Just like that. 2, 3, keep going, 4, 5, good job. Once you do about 30 reps, it's just, there isn't any magic to the number. This is what I've been telling people to do, and they've been having success. So it's just my own personal experience as an expert that this works, but you might play around with it and see if 10 reps is better for you, or 20, or whatever number works best for you. Then let's do this on the other side. Now you're gonna have to switch hands. So right hand's gonna be on the inner part. Yep, there you go. Perfect. Try to get the palm more on the outer side rather than the top. Does that make sense? Yeah, there you go, just like that. Sustain some pressure, so hold it and then give it some little extra forces. There you go. Good, good job. That's the technique right there to get that tibia to shift. And then let's do the exercise here next. So sit on up. You can be in your socks or barefoot. The idea here is to not have any friction, or as little friction as possible. So let's do the right leg first. You're gonna sit kind of, yeah, perfect like that, just near the edge of the chair, just comfortable. Then you're gonna move your foot out like that, turn your toes all the way in, and then drag your foot, not pushing into your foot, just kind of the weight of your leg, just let it drag as you bend your knee and get it as close to the chair as possible. Then reset, turn your toes in, and then you're just taking your time bending your knee. Can you bend any further than that? See if you can touch the chair. If you have space to go under your chair, you ideally want to go the full range of motion for your knee. Better. Good job. Turn in all the way and get it to come in, and you want to try to keep that knee pointed straight. It's going to want to come in, but just work yeah, that's better. Good. So I'm trying to push you out. The tendency is to let your knee, your thigh bone come all the way in, but you want to try to just make the motion come from the knee joint and down. There you go. Good. She's getting some good motion. The idea with this exercise is to get the inner thigh muscle. It's actually one of the hamstring muscles that we're trying to activate, not the adductors, not the groin muscles, but a hamstring muscle, because the way it connects to the shin bone, it's helping to get that alignment into the tibia aligned better with the femur. It's helping to improve the alignment of the knee. So 30 reps is what I do with people usually on this one. Again, you could play with the reps. There isn't any magic to the reps at this point. Let's demonstrate with this side. And it's the same idea there. Good. Toes all the way in. Some people like to curl their toes. That's fine. Just don't put pressure into the ground as you're sliding your leg. That's not what we're trying to do. You're going to activate muscles a lot. This exercise should not be strenuous. It should feel like it's warming up your leg, if anything. It shouldn't feel tiring. It shouldn't feel like you're wanting to sweat or gritting your teeth through this exercise. And you do about 30 reps. And the trick with this exercise is to do it frequently to make sure that you are benefiting from it. Because if you don't benefit after 3 rounds of this within a few hours, about once an hour, then it's probably not what you need at this time in your knee arthritis recovery. What's more necessary is probably fixing the root problem, because this is not going to solve the root problem. This is trying to just get the alignment improved, but it's only short-term relief. In order to fix a knee arthritis problem, you need many different kinds of treatments. This is just one of the treatments that I put in my knee arthritis recovery program, which covers the entire span, the entire process to heal a knee arthritis problem, to get to the point where you can avoid having a knee replacement surgery and get back to feeling phenomenal again. So now let's do the outer part. I'm just drawing you here. You do the same process as you find the little divot now on the outer corner of the kneecap, and I can feel that it's right there. That's the shin bone right there, and here's the thigh bone. All right, so this time you're going to put your right hand web space right below that line I drew out there. There you go, like that. Yep. And then you're going to push this way. Try to hold some force and then give it some extra pressure. There you go. And it's the same idea, 30 reps here. Good job. Okay, once you're done with that, let's just do one more there. Then let's just practice that exercise one more time. You can do it the same way. Some people think you're going outwards. You can try it. I've not yet had a patient that said they had a ton of success with it. So I'm still telling people to go inwards this way, same exact way, even though you're pushing on the outer part, trying to get the tibia to go inwards. And there isn't this is kind of new stuff. There's no like clear protocol to follow. There just isn't any medical information out there, research studies. It's just people like me that have kind of figured this out and seen success with patients. There's other therapists out there, other people that work on the body that do this stuff. So hopefully this can give you some relief from your knee arthritis problem, at least in the short term. Again, go check out the Knee Arthritis Recovery Program to get the whole program on how to fix knee arthritis from beginning to end.